Well, neonatal glycemia and neurodevelopmental outcomes at 2 years.
In neonates, hypoglycemia is common, and in severe cases it can cause neurologic impairment. But how low is too low? It's currently recommended that neonates be screened and treated when the blood glucose is 60 milligrams per deciliter or less. But recent studies suggest that blood sugars as low as 47 milligrams per deciliter are safe. Lowering the clinical threshold would significantly reduce interventions. But would it affect child development outcomes? The CHILD study was a prospective cohort study of 528 neonates born at 35 weeks or more of gestation and considered to be at risk for hypoglycemia owing to maternal diabetes mellitus, prematurity, less than 37 weeks gestation, and other factors. All subjects were monitored and treated to ensure a blood glucose of 47 or higher. 53% of them required treatment for hypoglycemia with a blood sugar of less than 47. The primary outcome was the developmental score on the Bayley-III test at the age of 2 years, as well as measures of executive and visual function. At 2 years, developmental outcomes in the children treated for hypoglycemia were similar to those in the children who were also at risk but had not reached a glucose level below 47. There were no significant differences in the Bayley scores on measures such as cognitive, language, motor, social emotional function, and adaptive behavior, or in the scores for executive and visual function. The authors conclude that neonatal hypoglycemia, when treated to maintain a level of at least 47 milligrams per deciliter, was not associated with adverse neurologic outcomes. Full trial results are available at nejm.org.
Application of 614 children, 528 were eligible, and 404 were assessed. 216 children had neonatal hypoglycemia glucose concentration. Hypoglycemia, when treated to maintain a blood glucose concentration of at least 47 milligrams per deciliter, was not associated with an increased risk of the primary outcomes of neurosensory impairment and processing difficulty, defined as executive function score or motion coherence threshold that was more than 1 point SD from the mean. Risks were not increased among children with unrecognized hypoglycemia. Well, those are the symptoms in a hypoglycemia disease, but in a disease called diabetes type 2. This ain't the case because we are talking about neonatal children, but those are symptoms when the glucose is low. A definition: neonatal hypoglycemia is a common and readily treatable risk factor for neurologic impairment in children. Although associations between prolonged symptomatic neonatal hypoglycemia and brain injury are well established, the effect of milder hypoglycemia on neurologic development is uncertain. Consequently, large numbers of newborns are screened and treated for low blood glucose concentrations, which involves heel stick blood tests, substance costs, and the possibility of iatrogenic harm.
Namaste. Tiny babies become bad
So this is a video that shows
when
how
their
to
blood
treat
sugar goes down.
hypoglycemia.
When sugar goes below 50 milligram per deciliter of blood or 100 ml of blood. At such times, give 2 ml of 10% dextrose per rectum as seen here. Babies are 2 kilos, then you give 4 ml. Give it slow with the help of a tube. If you don't have a tube, you can just put a syringe and push. This increases blood sugar from 50 to about 100 and keeps there for about an hour. This will save many babies. This is treatment of hypoglycemia, major cause of child deaths and child morbidity, that is child sickness. Try this, tell all. It needs no syringe and no needle, no pricking. Easy, anybody can do. Thanks, tell all. Dr. Heman Joshi, Viral. See our website www.drhaj.com.
The pros and cons. The pros is that it may be treated if the disease is recognized on time, the treatment works, and the neuropathy is secondary. And the cons is that once the neuropathy has developed, the treatment is harder. The age of the patient on this case makes it more effective, and without a treatment, the neuropathy is mortal.
Hey guys, it's Dr. Burke here. I had a patient recently wanted to know what causes hypoglycemia, and I want to create a little video on that. Hypo means low, glycemia, which means sugar in the blood. When the sugar goes down too low, you feel dizzy, irritable, craving for sweets, thirsty, depressed, all these different symptoms, okay? So if the sugar goes low, it's not good. If the sugar goes high, it's not good. But here's what initially happens. You start, even in my case, start off eating a lot of sugar. So as a child, you eat a lot of sugar, and you're eating large quantities of sugar. Now, if you think about it, when you measure your sugars, it should be like between 80 and 100. Massive whiplash to that pancreas. That's a trauma situation. My body had to raise insulin so high to get this out and work so hard. If you do that a few times in a row, it's going to create a whiplash effect. So it's going to overreact and bring it down and keep it down there too low. Yeah, diabetes. Okay? And that comes from doing too much of this. And sometimes so funny, I have a comment on YouTube where people make these comments which they have no clue. They'll make a comment like, oh, eating sugar doesn't cause diabetes. It's all genetic. Like, really? Just genetic? We're born with that? That doesn't make sense. And also they say you can't ever cure diabetes type 1 because it's all just autoimmune. Well, what happens act and bring it.
Conclusion: neonatal hypoglycemia was not associated with an adverse neurologic outcome when treatment was provided to maintain a blood glucose concentration of at least 47 milligrams per deciliter. and those were the symptoms that are presented by the children. So that's it this time. Thank you.